Look here. This is the sagittal section of brain, is it? And this is the pituitary gland. This pituitary gland is attached to the brain, to a region of the brain called hypothalamus. This is hypothalamus, which is glandular, posterior pituitary, which is nervous, because posterior pituitary is made by the axons of the neurosecretory cells that are located in the hypothalamus. Posterior pituitary does not secrete any hormone. It stores and releases two hormones, two hypothalamic hormones, and those two hormones are oxytocin and ADH. This is anywhere, if this is pin anywhere, here, 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 it is infundibulum. Okay? This is anterior pituitary, this is posterior pituitary. You do not see the intraglandular cleft or the pars intermedia. This is just macroscopic anatomy or gross anatomy. Any question on pituitary? You know already some pituitary hormones, anterior pituitary hormones like thyrotropin or TSH, gonadotropins like FSH, LH, ACTH, prolactin, these are all anterior pituitary hormones. Hypothalamic hormones, at least you know the two that would be released from posterior pituitary, oxytocin and ADH. But there are other hypothalamic hormones already, I told you in today's class. Those are the releasing and inhibiting hormones that control the activities of the anterior pituitary glandular cells, like TRH, thyrotropin releasing hormone, like MRH, melanocyte releasing hormone, like CRH, corticotropin releasing. All releasing and inhibiting hormones are produced by hypothalamus. So, who is the ultimate controller? There you go, hypothalamus. If this is a master endocrine gland, hypothalamus is a master of master. King of kings. I'm just kidding. All right. Now let us go to thyroid gland. Look at the location. It's located inferior to the thyroid cartilage, inferior to the larynx. And the cartilage has a name from the thyroid gland. This is thyroid. You know, another ring-like cricoid. This is thyroid. Yeah? Adam's apple. But Adam's apple, is it present in women? Of course, Adam's apple. What is Adam's apple? It's a thyroid cartilage.
You just can't see it.
Just, yeah, it's very much pronounced in male, okay? But anyway. So there are two lobes, two lateral lobes, but 50% of the cases there is another very slender lobe in the middle called pyramidal lobe. But thyroid gland is made of thyroid follicles that you know, that is histology, okay? Thyroid gland, this region is called isthmus, connects the two lateral lobes. So what are the hormones secreted by thyroid glands? Or rather thyroid gland, there is only one thyroid gland. No, TSH is secreted by anterior pituitary. It's a T3, T4, and calcitonin. T3, T4 by the follicular cells, and parafollicular cells secrete over there, still written, I don't know whether I removed them or not, but anyway. On the posterior side of the thyroid gland, you see two pairs of parathyroid glands, small pea-sized structure. So, if I ask you, Name the hormone secreted by this structure. A simple answer, PTH. Or you can write parathyroid hormone or parathormone. Okay? So 2 inferior pairs and 2 superior pairs. Okay. Parathyroid hormone. Now, here is adrenal gland. Location, look, is that?
Above the kidney.
Looks like a hat, kidney's hat, isn't it? So it reminds me of one student, and he was a very good golf player. I forgot his name. And he had some subtle kind of humor. So I have that standing urinary apparatus. Have you seen that?
Yes.
And the adrenal gland is there too. So in one exam, in the digestive system exam, it was as a bonus question. What is that, you know? So most students got right, adrenal gland, supraadrenal gland, and that student wrote, you know what? Dr. M's hat, haha.
Oh.
But anyway, you know, today you learned that 80%, already I think I told you in the lab also, adrenal cortex, 20%, 80% adrenal cortex, 20% adrenal medulla. Adrenal medulla is formed of what cells? Chromaffin cells. You know, you can answer 2 ways, you know. If I say this is made of what cell, you say one answer would be chromaffin cells, okay. But when you say chromaffin, that means you're not sure. Okay? So your answer should be very assertive. Yeah? You're not asking me. You are answering. Okay, good. Chromaffin cells secrete what? Epinephrine and norepinephrine. And adrenal cortex, you can say adrenocorticoids, meaning those are all steroid hormones. The zona fasciculata, zona glomerulosa, zona fasciculata, zona reticularis, they all secrete different types of steroid hormones. Okay? All right. Now the pancreas. We are looking at endocrine pancreas. This is one islet, not islets. If I ask you identify the structure, answer should be islet of Langerhans or pancreatic islet. Okay? Maybe in the key you will find alpha beta cells, but I don't make a big deal. It's very difficult to identify from here. Okay? All right? And then the reproductive structures, like here, ovaries. You can see also the structure, because since this is combination of endocrine system and reproductive system, you look at the ovary, section through ovary showing ovarian medulla and ovarian cortex and maybe some ovarian follicles. Okay? I may ask you, name all the hormones secreted by the structure. You have to write ovarian hormones only. What are the ovarian hormones? Estrogens, progesterone, relaxin, inhibin. And here you see the testis in the scrotum. This is the testis here, and this is epididymis. Okay? Name the testicular hormones, or name the hormones made by the structure here. Testosterone and inhibin. We're done with endocrine system. Okay? Also, you can look at the chart over there. Another chart, just their location. You can see Johnson